Okay, so today we're going to talk about Chapter 19, the respiratory system, and the diseases. So we have pharyngitis, influenza, common cold, acute otitis media, whooping cough / pertussis, and tuberculosis. So starting off with pharyngitis. Pharyngitis is the inflammation of the pharynx, and its symptoms are sore throat, which the incubation period of that is about 2 to 5 days. Typically you'll have pain and swelling in the throat. Sometimes it can lead to foul-smelling breath. You can also have a swollen mucosal membrane. Some causative agents in more serious cases are Streptococcus pyogenes, which can lead to scarlet fever, rheumatic fever, and extracellular toxins. Another causative agent is Fusobacterium nectophorum, or just viruses in general. There's no vaccine to prevent this, and if you look at the pictures on the left of the slide, you'll see the difference between a viral infection of pharyngitis or the streptococcal version of it. And if you look on the right of the slide, you see a cutaway view of the streptococcus virus itself. And this can be compared to a sinus infection, but the difference between the two are the inflammation of the cavities around the nasal passage is the sinus infection, but the pharyngitis is just the pharynx. And then on the next slide for the chart, you see the causative agents listed again, and for each of them they have a different font which lines up with the next boxes. So for the Streptococcus pharyngitis, you can see the mode of transmission is droplet or direct contact. The virulence factors are LTA or M protein, and hyaluronic acid capsules, SLS and SLO, and super antigens, and induction of autoimmunity. The culture / diagnosis are beta hemolytic of the blood agar, and sensitivity to bacteriactin, and rapid antigen tests. Prevention for all of them are hygiene practices, and also penicillin for others. And 20 to 30% of the cases in the U.S. are Streptococcus pharyngitis, and up to 15 are acute pharyngitis in teens and young adults, are caused by the Fusobacterium and Bacterium necrophorum, and viruses are responsible to 40 to 60% of all.
The common cold is a viral infection of the nose and throat. This disease is usually harmless, and generally symptoms only last 7 to 10 days. Signs and symptoms of the common cold can be sneezing, coughing, scratchy throat or sore throat, runny nose, and fatigue. Children can also experience a low fever. Symptoms usually begin 2 to 3 days after infection. The common cold and flu symptoms can be very similar. Common cold symptoms are usually confined to the nose and head, while flu symptoms are much more severe and throughout the whole body, consisting of a high fever, chills, and body aches. Approximately 200 viruses can cause the common cold. The common cold can be transmitted by indirect and droplet contact. Virulence factors are attachment proteins, and most symptoms are induced by the host response. A culture or diagnosis is not necessary for the common cold. To prevent the common cold, hygiene practices like hand washing, washing down surfaces, and coughing into your elbow should be implemented. Treatments are only needed if you have symptoms, and if your symptoms get more severe, then you should go see a doctor. And highest instances are among preschool and elementary school children, with an average of 3 to 8 colds per year, and adults and adolescents average 2 to 4 colds per year.
Okay, acute otitis media is technically an ear infection and not an upper respiratory tract infection, but it is caused by bacteria in the upper respiratory tract, so it's in this chapter. I'll go to the picture. It's caused by bacteria that travels up the eustachian tube, which connects the middle ear to the pharynx, which the upper respiratory tract bacteria, that's how it gets up to the middle ear. There is acute otitis media, and then there's chronic otitis media, which the fluid remains in the middle ear for indefinite periods of time, and the new data suggests it's caused by mixed biofilm bacteria, which, as we know, biofilms are much harder to treat with antibiotics because they're made of a ton of different bacteria. Yes. Next slide. There's 3 different causative organisms for acute otitis media: Streptococcus pneumonia, which is a gram-positive, Candida auris, and then just general bacteria and viruses. Modes of transmission are endogenous, or unknown for the Candida one. Virulence factors for Streptococcus, it's capsule or hemolysin, and then for Candida, it's adherence and biofilms. Diagnostic tests and culture, you typically have to rely on clinical symptoms. There's not much else you can do. There's no way to really obtain bacteria from the middle ear. So you mostly have to rely on clinical symptoms, which symptoms could be faint fever, pain, or pressure in the middle ear, and sometimes the pus will leak out of your ear. Also, you could have temporary loss of balance because of so much pressure in your middle ear, causing a lot of pressure in your vestibular system, which accounts for balance. Prevention. For the Streptococcus, there's a conjugated vaccine, and for the other 2, there isn't really any prevention that you can do. Treatment, most often you have to wait for resolution, just kind of let the body get it out as it normally would with your immune system. Epidemiological features, 70% of children experience at least 1 case before the age of 2, and then chronic otitis media results in significant hearing loss.
Okay, so the next respiratory disease is pertussis, also known as whooping cough. Incubation period is 3 to 21 days. Then there's the catarrhal stage, which lasts 1 to 2 weeks. This begins when bacteria is present in the respiratory tract. Symptoms are cough, sore throat, sneezing, body aches, low-grade fever, most notably a runny nose. Then there's the next stage, the proximal stage, which is symptoms of severe and uncontrollable coughing. And then the last stage is complacent stage, which is that number of bacteria decrease and symptoms have subsided. And then to the chart to the right, make sure to make note of that and to stop and to write it down since it will be on the test. Causative agents are Bordetella pertussis bacteria, which is gram-negative. Modes of transmission, which is droplet contact. So this is touching the patients or surfaces in their room, or like when a patient coughs or sneezes. Virulence factors are fimbrial hemagglutinin, pertussis toxin, tracheal cytotoxin, and endotoxin. Culture and diagnoses is PCR, or growth on the bacterial and BD. Charcoal or potato glycerol agar. Prevention is the acellular vaccine, azithromycin, and then the sulfonylurea methazole. Treatment is azithromycin, erythromycin, which is also known as antibiotics. And then the epidemiology features is resurging in the U.S. and other countries internationally, similar pattern of the gradual increase. So my chart in the upper left, So this is highlighting the number of cases before, I believe that says 1922 to 2018, and you can see that it plummeted in like the 1970s, and this was due to the vaccine that was created in 1950s. But we can also see a rise starting in 2012 and 2013. All the deaths from pertussis in 2013 were babies younger than 6 months who had not been fully vaccinated, and they contracted pertussis from their caregivers who were not effectively vaccinated. But researchers are working on a vaccine for babies and vaccines for expectant mothers.
Tuberculosis. Tuberculosis is a disease caused by a bacterium by the name of Mycobacterium tuberculosis. The bacteria usually attacks the lungs, but it can attack any part of the body, such as your kidneys or your spine or your brain. Now, it is transmitted through respiratory droplets in the air, and it can be spread when an infected person coughs or sneezes. The virulence factors for tuberculosis are the bacteria's waxy surface and the ability of the bacterium to stimulate an immune response that contributes to the disease's pathology. So culture and diagnosis, there are several ways to detect tuberculosis in humans. The first is a tuberculosin test, which is one of the ways that this is done is just testing for hypersensitivity. So testing like usually on the skin. So a lot of like most popular test is a skin test done. Another test done is the interferon gamma release arrays. And then we also have gene amplification and antibiotic susceptibility testing. And also acid-fast staining testing. Now, in order to prevent tuberculosis, you can limit exposure to infectious air particles. In hospitals, this is done by placing certain patients in negative air rooms. And also vaccination. There is a vaccine, although it's not generally used in the United States. There is a vaccine that is called BCG that is deployed in many other countries. Now, treatment for tuberculosis is dependent on the state of the virus or the bacterium. So there's latent TB, which is treated by rifampin and rifampicin for 4 months, and then isoniazid for 9 months. And then in active TB, it is a 2-phase process where it is treated with rifampin, isozyme, ethambutol, and pyrazinamide in the first phase for 2 months, and then in the second phase, it is treated by rifampicin and isoniazid for 4 to 7 months, or on a case-by-case basis. The epidemiological features of it is that TB is what the book calls an infection of poverty, which basically means that the bacterium is more likely to be found in developing countries or within people who are from lower countries where healthcare and medication is not as advanced as it is now. So one of the statistics is that 60% of the infected people of TB are foreign-born persons. And also areas such as nursing homes, jails, and hospitals are also more susceptible. So TB is split into two. There's primary TB, which in primary TB, the alveolar macrophages eat infecting bacteria but do not kill them, and so the bacterium of TB multiplies within the lungs. And so then after 3 to 4 weeks, the immune system launches an attack on these bacterium, forming tubercules. While the immune system does stop the progression of the infection, it also can cause disease due to damage due to the fact that the tubercules will often break down into necrotizing lesions that gradually heal through the process of calcification, where the normal lung tissue is replaced by calcium deposits. The secondary tuberculosis, otherwise known as reactivation tuberculosis, is generally found in patients who have more or less completed the first episode of infection, but the live bacteria remains dormant within the infected person for a while, and it can be reactivated after weeks, months, or even years, especially in patients who might have a weakened immune system. So these patients will experience a gradual increase in the severity of their symptoms, and will most likely include vomiting, coughing, greenish or bloody sputum, low-grade fever, anorexia, weight loss, extreme fatigue, night sweats, and chest pain. If untreated, the secondary TB has a mortality rate of 60%. There is also another strain of TB that is known as multi-drug resistant TB, which is defined as being resistant to at least two of the microbiotics used in order to treat it. In order to combat this, the treatment is extended drug therapy, which can last up to 18 to 24 months with 4 to 6 different drugs. This is particularly common in people who have already been previously treated for TB, and out of nearly 500,000 cases, 45% of those were found in India, China, and the Russian Federation. People with multi-drug resistant tuberculosis are generally sicker, and there is a higher mortality rate than those who are infected by non-drug resistant tuberculosis. And even though they receive treatments, about half of these patients do unfortunately pass away.
So our additional disease, we chose to do influenza or the flu. It's a very common virus. It's considered to be seasonal, so around winter time, and to make you feel lousy, as the book quotes. It binds primarily to the ciliated cells of the respiratory mucosis and leads to rapid shedding of these cells. There's an incubation period of 1 to 4 days. And after incubation period, symptoms tend to develop very quickly. With the infection, it can lead to pneumonia, which can also then lead to death. Many people die yearly from the flu. There's 3 different types. There's influenza A, influenza B, and influenza C. The book didn't go into depth between the difference of these 3. Some of the signs and symptoms that you experience with influenza is headache, chills, dry cough, body aches, fever, stuffy nose, or a sore throat. On the picture on the right, you can see a picture of the virus cells and all of its different components. And then on the next slide, you see a chart kind of summarizing the different viruses and the different modes of transportation. Mostly it's spread through direct contact or droplet contact. It can be spread through the air, inhalation, from coughing, sneezing. And so to prevent this, there's a vaccine you can get to prevent it, and also hand hygiene. And the different virulence factors are the glycoprotein spikes, which are able to change genetically and slow down the immune system. To culture and diagnose this, it's considered to be a gold standard. The gold standard is RT-PCR. So you can take a test to see if you have the flu. You can take different drugs to help treat it. And then again, the flu is seasonal, and about 16,000 to 60,000 die in the U.S. and about 250,000 to 500,000 internationally die.
Okay, so for our case study, we have a patient comes into the clinic saying that his breath has been smelling very bad the past couple days, and his throat is very sore. Upon your initial inspection, his voice sounds very hoarse. Based off his signs and symptoms and past experiences, you decide that a beta-hemolytic test will best determine what bacteria this is. The three questions that we have for you is, what respiratory disease is this, and how did this patient most likely obtain this disease? Question number 2, what would be a treatment that you could teach this patient to help reduce risk for infections? And then 3, what treatment could you give to help reduce his symptoms? And then just take a second and pause this to answer.
Okay, question number 1. Based off his signs and symptoms, this would be pharyngitis. Based off his bad smelling breath, his sore throat, his hoarse voice.